name's Sorbo Gangola. Been practicing for about 20 years, and I own two facilities in southeastern Michigan, Shelby Township and Chesterfield Township, and pretty much focus on outpatient orthopedics, sports medicine in my entire 20 years. I practiced 7 years for a local hospital, and when I left the local hospital, went to practice in a private clinic. 6 months after I hired on with this private clinic that had pursued me from the hospital, they sold to a national company, and I was very optimistic. Hey, continuing education, all those things that a big corporation can bring to the table, and none of those things happened. They basically came in, bought a lot of facilities, fired a lot of staff, and then had me running between two clinics. Patient care, quality of care wasn't a priority, and I felt that that should be baseline, and that you should be able to grow from there and develop. And in physical therapy, you can only go so far with your development. So I really wanted to get into an environment where I could bring new programs on board and be instrumental with making those decisions and doing quality care, and at the same time, getting into hopefully a financial situation where you could grow and reap the financial benefits as well. So at that point, I decided, I'd really like to consider opening up my own place. I had thought about it as early as when I was in PT school, but once I got out, all that's put in to open up your own facility, I knew it was a lot of work. But at this point, I decided it was something worth looking into. I heard about USPh through a family member who was meeting actually with the CEO of the company back then and was doing breakfast, and he invited me along. He said, these are people that help physical therapists open up their own facilities. So I was definitely interested. So it was in a roundabout way. I went to the breakfast and was able to meet with the then CEO and discuss some of my ideas. And right away he said, I'm gonna put you in contact with the vice president in charge of recruiting. And so I met a wonderful man that over the next 2 to 3 months helped me go through the steps required to be considered a partner. It's a pretty quick process. Basically, they want to know about you, your plans, what type of clinic and where you'd like to set up. So me and my husband were able to go and kind of scour the area, and then what type of physicians you know, and meeting with them, and then obviously doing the very detailed due diligence. So that all happened in a matter of 2 to 3 months, pretty quickly. USPH's role in helping with the setup of your clinic was pretty important. You shoot for the stars, you want all this top-notch equipment and everything possible to treat your patients, but you realize very early on that cost containment is important too, and that as your clinic grows, so can your expenses and your obvious equipment that you're going to purchase. And so they had a basic setup that I could follow, and then based on my specialty and the patients I was going to be treating, you could add things to it as necessary. They had several different types of clinic setups, from color-coordinated type things that they did with professional decorators that would come in. So during the build-out process, you were able to pick the colors and things that made the clinic a little bit more uniquely yours. Starting a clinic on your own can be so overwhelming. As a clinical specialist, I've been practicing for 10 years when I first partnered with them. So I knew the clinical end and how to treat the patients. It was getting the patients in the door, learning proper marketing techniques, selling yourself, which you don't learn in school, and then all the ins and outs of bringing staff on board, offering them benefits in HR, getting on the insurance plans. USPh, together with other clinics that they had already started within my area, knew what insurance plans, what they paid, how to get on those insurance plans. So from the time I became a partner, before I even opened my doors, they were pursuing those contracts already. And so I could spend my time out marketing and letting people know when my doors were going to open. Staffing was another part that USPh was very instrumental in educating me on, because I had always been a senior clinical therapist, but was never really in charge of staffing and recruiting and interviewing. So they helped me in the recruiting process to recruit an office manager, and at first, starting out, it was an office manager and myself. The training that I received was in the marketing end, because as licensed physical therapist, you don't really learn how to market yourself. So I came in and learned how to market and how to go out and get my name known in the public, and then they did train my office manager on the proper procedures and billing and computer work and things like that I wouldn't have had time for. The most important part of opening up my own facility was I wanted to set the example and set the par very high on quality care, and then be able to bring in program development and be a part of the community and do community-related activities. So USPh allowed me the time to do that, and even now, being partnered with them for over 10 years and having 2 locations, I'm still able to do that. I can think of several situations since I partnered with USPh where I was able to contact them and they were able to then run with this issue that probably would have taken 100% of my time. For example, we've had certain insurance contracts where our reimbursement, we were getting paid, but we weren't getting paid at the proper amount. Or there were issues within the insurance system itself where maybe they had the wrong billing address. And getting to the proper people that can just enter that information correctly and resolve it is something I would never have the power or the education to do. So I make one phone call to USPh, and they're able to handle that immediately. Since I've partnered with USPh, it's really helped with my personal life as well. I'm able to balance family with clinical care and not have to work 80 hours a week like so many business owners do. USPh allowed me through the recruiting to interview and to learn how to interview, to bring the appropriate staff on site so that when I'm not at the clinic, I know I've got my highest quality, best staff there, which is a reflection back on me. It has been very profitable, I'm happy to say, each year growing. We've been through very tough economic times in Michigan, obviously, as everyone knows. So in those times, USPh has come forward and has brought new programs to the table that I've been able to introduce. New forms of marketing has informed me on bringing several salespeople to the table so that I don't have to do the marketing and sales on my own. And all these things has helped keep me ahead. I see myself continuing to manage my 2 clinics, but never say never in terms of opening up more. You never know when an opportunity arises. And continuing to do program development based on the needs of the community. Very happy since I partnered with USPh, absolutely.